Hello everyone, today we are going to talk about the antimicrobials, and in this video I will mainly focus on the penicillin. Before starting, I would like to share with you something. I have cleared my FMGE within first attempt with 169 marks, and the my experience was not that much hard. The exam level was okay. So if I have cleared it, then you can also clear it. So it's not that hard, not that easy, but you have to know that what you should study, what they ask often in exam. So that's why, and at the last moment you have to revise it multiple times. So on that basis I am here making the video. So let's start. So this is antimicrobial. We know it is against the microbes. Okay, so first we will talk about the cell wall inhibitors. Like for example, this is a bacteria. Suppose this is a bacteria and the bacteria has cell wall over here. Okay, let me zoom it. So the bacteria has cell wall over here. So if we just inhibit, if we just give some drug and the drug will inhibit this area, what will happen? The bacteria will not survive. So that's how we are giving certain drugs which is inhibiting the cell wall. Number one is beta lactam, and number two is the glycopeptide. First we will talk about the glycopeptides. So there are various type of glycopeptides. For example, dalbavancin, telavancin, etc. But mainly we are going to focus on the vancomycin, because that's this vancomycin they ask often. So basically the vancomycin is a drug of choice for methicillin resistant staph aureus, and also a drug of choice for enterococcus. Okay, and also we can give in the clostridium difficile. Then another one is this if for example, suppose the patient is like methicillin resistance. First we give to the patient the methicillin, but the bacteria is so strong that it is resisting that medicine. So next we are giving here what we are giving here, vancomycin. But what happens is the bacteria develop further, and now it is also resisting the vancomycin drug. That time, for that one vancomycin resistant staph aureus, we will see how it's happened basically. So basically that time what happened is that there is like development, or we can say there is change in the biochemistry. For example, in the vancomycin resistance, what happens is the d-alanine is get converted into d-alanine lactate, and that's how this chemistry is changed, and that's how the bacteria is able to resist the vancomycin also. Now let's talk about the side effect. So vancomycin has a side effect which often asked in exam also, that is red man syndrome. Why it's happened? Because while the patient is taking this vancomycin, in the patient body there will be vasodilation. The vessels will dilate, and why so? Because of histamine release. Okay, so let's not go into too much detail. So due to that, the patient will appear rashes. The patient will appear red, and there will be rashes on the patient. Okay, red rashes also. So that is exactly the red man syndrome, which is due to the vancomycin. Then let's begin our the beta lactam. Second, like cell wall inhibitor, beta lactam. Okay, now the beta lactam is further categorized into three groups. Number one is penicillin group, number two cephalosporin group, and number three carbapenem. First we see the penicillin, and in this video we are going to focus on penicillin. Sorry. The penicillin will act on, especially the penicillin G, it will act on the gram positive and gram negative. Okay, and it is also a drug of choice for gas gangrene. Okay, gas gangrene. So basically we see in the penicillin G there is G. Okay, so it is used in gram positive and in few gram negative also, and in drug of choice for gas gangrene. That's how I remembered it. Okay, then also penicillin can be used in meningococcus, then actinomyces, then strep and streptococcus, then tetanus, then treponema, anthrax, etc. And as a mnemonic we can remember like G Masten loves yours, or we can say G Master loves yours, means that yours, or just for remember purpose you can just learn that. Okay, that where the penicillin are basically used, it is just a mnemonic. Okay, then we will talk about another one, that is our extended spectrum penicillin. So in extended spectrum penicillin, we can say there is ampicillin, amoxicillin, piperacillin, and so much more, but let's not go into detail. In exam they often often ask about this one and this one, piperacillin. Okay, piperacillin is basically used in pseudomonas, and we can remember PP. Okay, that's how. Ampicillin is a drug of choice for listeria. We have to remember that one. Okay, then let's talk about the side effect of the penicillin. So penicillin side effect, if the patient is taking penicillin, it might happen that as a side effect the patient can get either hypersensitivity or the patient can get anaphylaxis. Okay, and if the person is allergen, one very important key feature is if the person is allergic or allergen to the penicillin, then all other beta lactam should be avoided. Yeah, we should avoid beta lactam if the patient is already allergen to penicillin or allergic to penicillin. Then we should avoid giving other beta lactams. Okay, like we should avoid cephalosporin, we should avoid the carbapenem. Now, except the monobactam, because in monobactam there is only one ring, so that will not react, and the medicine will come by the name of like aztreonam. Okay, then another one is resistance to penicillin. If there is resistance to penicillin, we will gonna use extended spectrum beta lactamase. Okay, and in this one this group consists of the carbapenems group, and the carbapenems are basically the drug of choice in the resistance penicillin problems, or we can say pathogens or disease. Okay, now in the clinical practice, some combos are used of penicillin or beta lactams. These are, for example, clavulanic acid with amoxicillin. Okay, and if amoxicillin is not available, we can use ticarcillin. Then second one is sulbactam plus ampicillin, and third one is tazobactam and piperacillin, which comes under the name of piptaz. Okay, so that's for today, and about cephalosporin we will gonna discuss in the next video.